Millions of HIV tests are carried out worldwide every year, and prevention efforts to end the HIV epidemic are working. However, there is still a significant number of people infected with HIV who are unaware of their status. OraSure Technologies has developed an oral self-test that has had successful results in the US and Africa and will soon be available in Europe, offering a private and pain-free route for individuals who may not want to go to a clinic to check their HIV status.
Taking an HIV test at home offers privacy, convenience and confidentiality. And now that a test can detect antibodies on the gum line, there's no need to draw blood or send it off to a lab. With the OraQuick oral swab test, the result is available in just 20 minutes. The test from OraSure Technologies was the first HIV self-test to be approved by America's FDA, and the first to be pre-qualified by the World Health Organization.
It's highly accurate, and it will give you the result very quickly without the need of pricking your finger or giving blood. The other advantage is there's no virus in the mouth. You can't catch HIV from kissing. So there's no contaminated material during the process of testing. So the test is very safe. The HIV self-test allows individuals who may not wish to go to a clinic to obtain a test at home, test themselves in private, and if they are positive, they can then seek out additional testing, confirmatory testing, and linkage to care, and get the treatment that they need to keep themselves healthy and live a normal life.
It was in Malawi, Central Southern Africa, that pilot studies and ethical assessments were carried out on the OraQuick test. The success of this pioneering work was a career highlight for Professor Liz Corbett.
People find it extremely empowering to be able to access a test conveniently when they need it. It's the only time I've ever seen big smiles when people don't normally smile when they think about HIV testing. But with self-testing, really that meets demand. We achieved really high uptake in some very difficult groups that are hard to reach otherwise, so adolescents and older people who for various reasons feel reluctant to test through standard facilities. Everyone just so delighted. Suddenly this worry taken away.
In the UK, at least 12 people are diagnosed with HIV every day. It's estimated that 103,800 people in the UK are living with HIV, of which 1 in 14 remain undiagnosed. Access to a mouth swab self-test could increase the numbers who get diagnosed and so get access to potentially life-saving treatment. Although Britain has significantly reduced the incidence of HIV, even surpassing the UN's targets, experts warn against complacency. Bringing the HIV oral self-test to Britain and Europe will offer earlier diagnosis, a cut in transmission rates, and another option to check HIV status.
Stigma still exists with HIV, but in the United Kingdom and Europe we are very lucky to have a strong infrastructure to look after those who are at risk and those who live with HIV. We'll be working with sexual health providers, HIV charities and pharmacies to make sure that anybody who wishes to test themselves with a HIV self-test that is based on oral fluid can do just that.
Anyone needing support before, after or even while taking a self-test can find it at the Terence Higgins Trust.
Self-testing complements existing face-to-face testing services in sexual health clinics, primary care and community-based settings. And it just offers more choice to people. So if they can't get it one way, they can get it another way. We've also done a lot of great work trialing whether doing assisted self-testing is an option to give people that confidence. So the bottom line is just as much choice as possible.
Choice, simplicity, convenience, especially at a time when normal health facilities may be harder to access. The first HIV oral self-test coming to Britain will help more people be sure of their HIV status and, if positive, seek the care they need.